Discover the latest health tips, expert advice, and inspiring stories. This is the Health Channel Podcast. Your journey to better health starts now.
Whether it's children, adults, or senior citizens, household dangers can pose a real threat to the safety of our families. On today's show, we're going to talk about some of these potential dangers and how to stay safe from them, as well as answer your healthcare-related questions here on this episode of Ask the Doc. No appointments needed. Hello, and welcome to Ask the Doc, No Appointment Needed, the show where you can send in your medical questions and get them answered by our healthcare experts. I'm Dr. Kamaljit Kaur, a concierge primary care physician here in beautiful South Florida. It's great to have you here with us today. So let's get right to it. Our first question comes to us from Harris, and Harris has emailed us asking, "My parents are aging, and one of my biggest fears is for them having an accident at home. Am I overreacting, or should I be concerned about them getting hurt at home?" Harris, thank you so much for asking and writing in with this question. This is a very common question that we get for senior citizens. I worry just as much as you do, Harris, about my mom. Now, she's in her 60s, and that might be senior citizen age, but she's quite lively and sprightly, as I hope your parents are as well. Part of that, though, is me worrying about her just like you're doing. And in fact, I just bought her a nightlight the other day because sometimes she gets up in the middle of the night and I get worried, well, what if it's too dark and she can't see? So just like the video was explaining, there's a lot of things that we can do. And not only as concerned children, but, as a primary care physician, it is my responsibility to, in order to help ensure the safety of my patients, to ask them about this. So once a year, when our senior citizen patients come in for their annual wellness exam, one of the things I do is ask them about these potential hazards. Do you have loose rugs in the house? Do you have floor tiles that need to be fixed? Do you have grab bars in the shower or bathroom if and when you need them? Sometimes the entrances to the house have stairs. Do you have railings along those stairs? Do you have slippery bathtubs? What about your medications? Where are they kept? And what about fire hazards and other things that can potentially cause harm to them? It's very, very common to think about these things. So no, I don't at all think that you're overreacting. Now, some of these things do need to get fixed. For instance, my mom will often call my husband and ask him to change a light that's too high for her to get onto. Otherwise, she'll probably try to get on a chair and do it herself, and that is not at all what we want her doing. Sometimes, just like the video explained, those loose rugs, you either need to secure them to the floor or maybe even get rid of them and make sure that whatever flooring that is there has good grip and is not slippery. Cleanliness is also very, very important because you don't want your parents falling or tripping over anything that was left behind. Overall, there's a lot that can be done, and that also means there's a lot that can be dangerous. So I'm glad you're there to help them and to have these concerns and really to help protect them. As children, it's usually them protecting us, but as they age, that's when they need us the most. So I hope you are there for them and able to do these things. Let's get to our next question. This one comes to us from Olivia, and she's emailed us and asks, "My mother takes a lot of medications and has pill bottles all throughout the house. I love taking my kids to see their grandma, but I'm very concerned that they will accidentally pick up something that can harm them. What can I do to get her to change the way she stores her pills?" Hi, Olivia. Thank you for sending us this question. Going to grandma's house is often a treat because we know we're going to get spoiled and goodies and love and all the goodness that comes with that. However, there are certain hazards that must be addressed. Just like in the previous question, when we spoke about hazards for senior citizens, some of those things can also be hazards for children as well. And yes, prescription bottles are at the top of that list. The type of medications that senior citizens are usually on can pose a real danger to children if they accidentally ingest them. This is also why that a lot of times these prescription bottles and even a lot of over-the-counter medications now come with child-proof locks. Sometimes it's even difficult for me to get them open, but this is why that it's becoming more and more predominant. In fact, when you go to the pharmacy, especially for senior citizens, the pharmacist will ask if they want the childproof caps and covers on those medication bottles. I think the first thing to do is to discuss your concerns with your mom and really in a non confrontational manner. We don't want her to feel like she's been doing anything wrong, right? She might not even realize that this is a threat or danger for her grandkids. Express to her why it worries you and then allow her to provide you her thoughts on it. I'm sure that once she sees that this might be a potential danger to her grandkids, she's going to do what she can to help protect them. Another good way, in addition to the child-proof caps, is to designate a specific area in her house just for these medications. Now, you want this to be in an area where she can easily get to, but maybe not so easy for the children to reach. It's also a good idea if this cabinet is locked most of the time. This way, it will minimize the risk of the children getting to this and posing a danger to them. Our next question comes to us from Bart, who checks in from Facebook and asks, our baby is now 11 months old, and I am now scared to death about her becoming active and getting around the house. I'm scrambling to baby-proof the house, but want to make sure I'm not missing anything. Help! This is a great question. And 11 months, that's when they start to get really rowdy and move around. So this is a good time. So don't feel bad that you might be a little late on this. But it's so important to discuss and to think about. Let's offer some ways that you can keep your baby safe. Let's start with the kitchen. Now, in the kitchen, you can place lockable covers on garbage cans. You might not think about it, but sometimes you can throw away something that might be dangerous if a child gets into it. Glasses and dishes, you can keep them out of reach. A lot of time, glasses and dishes are made of glass or porcelain or some kind of breakable material that if they fall onto the child or onto the floor, those sharp edges could cut them or, really hurt them. And we don't want that to happen. Also, think about unplugging small appliances when you're not using them. You can also use covers for the outlets and the stove to make sure that little hands can't get to them easily. And then another one that a lot of people don't think about a lot of times is tablecloths. Now, tablecloths can certainly pose a danger because say the child is crawling on the ground or walking around and tugs on the tablecloth. Well, then that poses a risk of whatever's on the table. Sometimes we like to keep flowers in a vase or set the dining room table. If the child tugs on that tablecloth, all that stuff is going to come onto them and then that can really hurt them. So be cognizant of that as well. Now let's check out the living room and what we can do in there. If you have a TV, and most of us do, you want to make sure that it's anchored to the wall or stabilized in such a way that if little hands tug or push at it, it's not just going to fall. There's also a concern for lamps. If any lamps are wobbly or easily displaced, you want to make sure that they're out of reach, perhaps behind furniture, somewhere where the children can't get to them. Also, blinds. A lot of people don't think about this, but blinds, most of them have a mechanism to open and close them, and this is usually by a string or a rope. Sometimes that can be quite dangerous, especially if it's really long and it accidentally gets tangled around the baby or the child. That can be quite dangerous. So we want to make sure that those ropes and those strings are tied up and out of reach. Also, you want to make sure that if you have stairs, you have baby gates by them. So the top of the stairs and the bottom of the stairs. A lot of times, unfortunately, if you're on the second floor of your house doing something and your child is crawling around, they might accidentally crawl onto the top of the stairs and then go down the stairs. And that's the last thing that we want. You also want to make sure that carbon monoxide detectors and smoke detectors are installed appropriately and they're in good working condition. A lot of times we think that we have these smoke detectors and carbon monoxide detectors, but we forget to check their batteries. A lot of times they'll start making that annoying beeping noise too to let us know to change the batteries, but you want to make sure not only are the batteries in, but this works appropriately. Now, what about the bathroom? That's a very important place to baby-proof as well. One of the primary goals in the bathroom is to make sure that medications are stored properly and out of reach for children. Now, it is traditionally known that the medicine cabinet in the house is usually in the bathroom, and this might not be the case for everybody, but if it's the case for you, then you want to make sure that it's a higher cabinet and that it is locked. A safety lock on those cabinets is also very important, especially the lower cabinets. Now, we may not think about this, but sometimes we keep cleaning products underneath the sink, and that's closed with cabinets or drawers. So you want to make sure that that's locked as well. Also, the toilet seat. That's very important to make sure you have a lock on that. What about faucets, spouts, knobs? You want to make sure that there's soft covers on those items as well. And then the bathtub itself, you want to make sure that there is a non-slip bathroom mat so that if you, the child, anybody is in the tub, then they're not slipping around. Also, those mats that are usually put in the bathroom, you want to make sure that those don't slip around easily as well. Razors and shavers, very, very important. Sharp objects, of course, we want to keep them out of a child's reach, and these are no exception. Then we talk about the small appliances and products that we have in the bathroom. For instance, curling irons, hair dryers. You want to make sure that those are unplugged when you're not using them or when you're not around. Let's keep moving. Our next question comes to us from George, and this is actually a very important question. I have been suffering with lupus for a long time. I've seen a doctor about it and talked about products that I hear might help it. I've been told that men rarely get it, but here I am, a man, and I have lupus. Do you have any suggestions for how I can get a little relief from the symptoms? Hi, George. Thank you for reaching out and sending us this question. I am very sorry to hear what you're going through, and I hope that you do get relief. While there's no particular products or items that are over the counter that can help take away lupus symptoms completely, there are some that might help. For instance, medications like non-steroidal inflammatories. So we're talking about Motrin, ibuprofen, Aleve. If you're able to take these medications, these are often well to do in lupus patients when there's a lot of pain because it is an inflammatory process. Also, hydrocortisone cream over the counter can help with rashes when they come on during lupus flares. Sometimes these rashes are itchy and inflammatory, so sometimes that might provide minor relief. But more than products, one of the best things that you can do to find relief from your symptoms is a healthy diet. An anti-inflammatory diet, regular exercise, adequate sleep, and reducing stress as much as possible. I hope these things help and give you more than just some relief. I wish you well. All right, we just got another question, and this comes to us from Llewellyn, and she writes, the bottom of my feet feel like they're very tight, and I'm wondering if you could explain to me why my feet feel tight. The problem is mostly on the bottom of my feet. Please let me know what you think is going on. Hi, Llewellyn. Thank you so much for sending this question. And this is one that I'm very familiar with personally and through my patients. While I would need some more specific details and really examine your foot to know exactly what's going on, I think what you're talking about is something called plantar fasciitis. Now, when somebody tells me that the bottom of their feet hurt or is feeling tight or inflamed, this is often what is going on. So what is it? Plantar fascia, which is a band of semi-thick tissue that runs from your heel to the front of your foot, can sometimes get inflamed. Now, this fascia, basically the band of tissue, is responsible for helping the movement of your foot and also supporting the arch of your foot. For one reason or another, though, this can become inflamed and angry. And when it does, it produces pain in the area of the bottom of the foot, but it can also get really, really tight. Sometimes it's something minor and you just need to do some stretches or maybe take some anti-inflammatories for it. But sometimes if the symptoms continue or just aren't getting better or are really, really severe, you might need something more invasive like a steroid injection in addition to physical therapy and stretching and all that. So there's a lot that can happen at the bottom of your foot, but this is usually the first thing we talk about. I do encourage you to talk to your primary care physician about it, get it examined so you can get the appropriate advice and treatment and get you feeling better real quick. All right. Our next question comes to us from Anna, who reached out to us from Instagram, and she writes, my husband and I installed a pool before I got pregnant, and now that the baby is due soon, I am scared to death. Can you give us some guidance on protecting our baby? And when should we start teaching her how to swim? Hi, Anna. Thank you for reaching out. And firstly, congratulations on your growing family. This is an exciting time, and I would hate for it to be clouded by fear, especially when there's something that we can do about it. While a pool can be such a fun place to spend family time, it can certainly be a hazard, especially for children under 5 years old. One of the best things that you can do is to install a pool cover or one of those pool fences that is directly around the perimeter of the pool. Now, this is going to minimize the risk of your child falling into the pool and having an accident or even accidentally walking into the pool. Make sure that the pool fence, should you install one, has a gate or a latch that is out of the child's reach, so maybe a little bit higher. Alarms are another good idea, whether it's an alarm that is on the door that leads to the pool, like your back patio door perhaps, or there's also these alarms that you can put on the child that will go off if it's submerged in water, even if it's bath water, it doesn't matter. The alarm will go off, and that's something that can alert you. Lastly, just as you're alluding to, teaching water safety, CPR, and swimming as early as possible will also minimize the risk of your child having an accidental drowning. Even if the child does fall into water, she's going to be able to know what to do, or at least to stay afloat. So when can you start? Now, we do see that there's many swim schools in the area and non-medical resources that recommend starting as early as 4 months old. However, the American Academy of Pediatrics recommends starting at age 1. Starting to acclimate your child and get your child in the water, well, that you can start as early as honestly 4 to 6 months. But actual swimming and learning how to do the movements, that recommendation is 1 year old. Now, all that being said, the single best thing that you can do to protect your child around a body of water is to keep an eye on them and to make sure that you or someone you trust is supervising them and remaining vigilant whenever the child is around water. Even if there is a pool cover, if there is a pool fence, the child is wearing an alarm, you might have all those other things in place, but the best protection is going to be your eye or the eye of a loved one watching them. I hope this information helps you feel a little bit better and a little less concerned, and this way you and your family can enjoy your pool. All right, our next question comes to us from Kevin, and he asks, I have heard for years about carbon monoxide poisoning. Can you explain exactly what it's from and what I can do to protect my family? Thank you for sending this in, Kevin. While this is something that maybe people think is more prevalent up north, because in Florida, we don't have, or at least South Florida, as much gas power in the house that Northeasterners and Northerners do. But this is still a very, very important question because carbon monoxide is a gas that is produced from burning fossil fuels. So like a gas burning stove or car fumes, these things can all produce carbon monoxide gas. Usually, proper ventilation in the house or the garage ensures that this really isn't a big deal and it's not going to be a hazard to our health. But there are times when this gas may accumulate in your home or in your garage, and this can really pose a health threat. One of the most important things to know about carbon monoxide is that it's a gas, but it doesn't smell and it has no color. So you really don't even realize that you're being exposed to it when you are being exposed to it. And let alone not even knowing that it's there, you don't even know what amount it's in. Is it a high amount? Is it a little bit? Honestly, there's really no way to tell just from smelling or seeing from your own eyes. And I think that's one of the things that makes it really, really dangerous, because if you're exposed to it long enough and it builds up long enough, excuse me, it can cause poisoning, and that can even lead to death, which obviously this is something we want to prevent. And it's also why CO2 or carbon monoxide detectors are so important in the house, especially around bedrooms and doors, because a lot of times what happens is there may be a gas leak, there may be a carbon monoxide leak that occurs while you're sleeping, and you may not be aware of it. And if that happens, if you have these detectors, they're going to go off and they're going to, sound the alarm for you and get you and your family to safety. The other thing about carbon monoxide gas is, like I said, it's colorless and it's odorless, so you don't see it and you don't smell it, but it is very common in houses that don't have proper ventilation. So if you are using any appliances that are using gas and are emitting CO2, you want to make sure that windows are open or there's exhaust fans, something that's getting rid of the gas as it's being produced. I hope that helps answer your question. All right, let's keep moving. Our next question comes to us from Arthur, and he's reaching out to us from Facebook asking, my grandkids are coming over and they are very active. We have stuff all over the house that I'm concerned could be broken or cause injury to them. What do you recommend we do to prepare for their visit? How exciting. I'm sure you can't wait to see them, Arthur. And this is a great question as well, because there's a lot of things in the house, as we've discussed on today's episode, that can pose potential threat and danger to young children. Sometimes these are things that we take for granted, but we need to be cognizant of them and know what to do to prevent any injuries and safety hazards. I'm glad you're aware of this. So just like baby proofing, it's important to ensure that all items that can pose a danger, even to older children, are safely stored away or put off limits for the kids. For instance, we talked about loose cords that come with blinds, but what about loose cords and wires from like the TV or the telephone? Those can be hazardous as well. Then items such as anything that's glass or breakable should also be appropriately stored away. And we talked about medications. So for sure, medications. What about alcohol? A lot of times we don't think about it, but sometimes there's a bar in the house or there's a place where alcohol is kept in easy reach. You want to make sure that alcohol is put away and out of reach when there's children in the house. Make sure that doors and windows are secured. I have a great story about that, actually. It's kind of personal. I crawled my way at 6 months old out of a second-story window and kind of fell on the ground. Well, not directly on the ground. Somebody was there to break my fall, luckily. But I was supposed to be being babysat, and whoever was babysitting me turned her head for a second. Next thing you know, I go crawling out of a window. And yeah, that was not a fun period for my parents, but you may not think about it. Make sure that windows and doors are always secured because you don't want to have any accidents, especially from those higher floors. Of course, these are just a few examples. If there's anything in the house that I haven't mentioned, but you feel is a hazard, definitely take care of it, take it out of reach, put it in another place, get rid of it, whatever you think is going to need to be done to keep the children safe. I hope you have a really good time with your grandkids because it is special. I know I used to love going to my grandma's house, and they were always on us like hawks, making sure that we're doing the right thing and we're safe and we're not getting into trouble, or not getting into too much trouble, I should say. It's a fun time. So I hope you enjoy it. All right, kids, it's been great. These questions were wonderful, and I'm so glad that you sent them in and we were able to answer them. As a primary care physician, it's very important to me, not just the health of my patients, but their overall safety, especially when it comes to children and senior citizens, because those populations are at higher risk for falls, for injuries, for accidental bad things happening, and we want to prevent them as much as we can. Again, my name is Dr. Kamaljit Kaur, and I'm a primary care physician here in beautiful Coral Springs, Florida, and my practice is accepting new patients. Hope to see you soon. Keep sending me those questions.
Thank you for listening to the Health Channel podcast. We hope this information has been useful. However, please remember that only your doctor can advise you about what is best for you. Do not start, modify, or suspend treatment based on anything you have heard on this podcast. Please join us again soon.